Robert F. Kennedy Jr. yesterday says he plans to direct the CDC to stop recommending the use of fluoride in drinking water, adding he's assembling a task force to focus on that issue. The announcement came at a news conference in Utah, which is the first state to enact a ban on the practice the American Dental Association has said reduces dental decay by at least 25% in children and adults. Kennedy has called fluoride a dangerous neurotoxin and said it's been associated with arthritis, bone breaks, and thyroid disease. The Environmental Protection Agency yesterday also announced it is reviewing, quote, new scientific information on potential health risks. As of 2022, the CDC says more than 72% of Americans receive fluoridated drinking water. Let's bring in NBC News medical contributor Dr. Vin Gupta. Dr. Gupta, good morning. Always great to have you, especially on set with us in New York. A lot to ask you about, but let's start right there. Fluoride in the water, viewed by most scientists, most people in the medical community, as an achievement of the 20th century, reducing tooth decay. Are there dangers to it at the levels it's currently in the drinking water?
Well, I'm glad we're talking about this, really, because this is a solution from the current health secretary in search of a problem. And that's the best way to put this. He's taking fringe data, which he often does. You and I have talked about this, and then extrapolating to something that is not true. And so for the American people out there, parents wondering, is the fluorinated drinking water in their community safe? The answer is yes. 99.9% of samples across the country, Willie, have been monitored by the EPA or the U.S. Public Health Service. They've been found to be within the limits of normal, less than 0.7 milligrams per liter, and which, to your point, then mitigates the risk of dental caries, allows children to stay in school, because it turns out if they have dental issues, they're pulled out of school. And there's no issues when it comes to neurodevelopmental delays. Again, this is fringe science. It hasn't been proven, even at levels that are outside the normal limits. So what the health secretary is doing is smoke and mirrors. He's offering a solution, cajoling states to do something, in which there is not a problem.
So is it fair to say, from your point of view and from the consensus of the medical community, that fluoride is not a, quote, dangerous neurotoxin associated with arthritis, bone breaks, and thyroid disease, as Kennedy claimed yesterday?
It is not a neurotoxin that causes any of those things. It's not been proven to cause any of those things. That's still very much an investigation at levels outside the normal limits, which, by the way, again, 99.9% of samples, if he shows us a data otherwise, 99.9% of samples, Willie, across the country are within the limits of normal, no association with what you just mentioned.
So, Dr. Gupta, let's turn to the measles outbreak. Secretary Kennedy was there in Texas. Now, a second child has died in recent days. Talk to us about where we are in terms of numbers. And we've, as chronicled on the show, we know vaccination rates have dipped. Is the health secretary and the federal government doing anything here to actually help this problem?
Well, a second child died, tragically, unvaccinated. Jonathan, we know 97% of the 607 cases that have been detected, most related to this outbreak in West Texas, are unvaccinated. And about 20% of those cases were children who required hospitalization. So this is very serious. Measles is more than just a rash, causes pneumonia, which is really the presenting symptom requiring hospitalization in these kids. I'd say the response has been muted at best. Finally, RFK yesterday in a statement or over the weekend said, 3 paragraphs down, vaccination is important and is the best way to prevent getting measles. But again, it's been muted. It has not been effective. Sadly, his messaging has been promoting things like vitamin A. What we've been seeing is that kids are actually showing up in hospitals in West Texas with vitamin A toxicity, and that can cause liver damage. And so his message is getting through in a really disturbing way on supposed treatments. And so it's really important to clarify that is not a treatment. But again, some of his false messaging prior is getting through.